Hello all, welcome to another video of EM Simplified. So many of you know that whenever we have a metabolic acidosis, we have a low bicarbonate. So it is a natural practice that comes in your mind that why can't we replace with soda bicarbonate? So whenever we discuss regarding soda bicarbonate for metabolic acidosis, we should know the pros and cons and when we should actually give soda bicarbonate. So for every metabolic acidosis, it is not recommended to give soda bicarbonate. There are certain reasons behind this. So let's see what are the major disadvantages of giving a soda bicarbonate. First of all, you have to understand that it's a hypertonic saline, so it can cause volume overload. So already the patient might be having metabolic acidosis, renal failure, or there is a volume overload. So by giving an extra soda bicarbonate, you are increasing the volume load. As a result, the patient's breathlessness can worsen. So that is one thing, it can cause volume overload. Then the moment you give soda bicarbonate, you think that your acidosis is getting corrected. But on the contrary, what is happening? There is worsening of intracellular acidosis. So metabolic acidosis, when you look at the pH and all, there might be some improvement, but technically speaking, there will be worsening of intracellular acidosis, and also there will be hypercarbia. So that is the one major disadvantage that you need to remember. Another issue that you need to keep in your mind, it can cause significant hypokalemia. So we used to treat for refractory hypokalemia or hypokalemia with metabolic acidosis with soda bicarbonate. Similarly, when you give soda bicarbonate, it can cause hypokalemia. So it should not be used, and further you can have conduction. Already there is a metabolic acidosis and you're worsening hypokalemia. By giving your soda bicarbonate, it can further precipitate more and more arrhythmia, and the patient can suddenly have ventricular arrhythmia. So that is another disadvantage. And another thing is that it can also cause ionized hypocalcemia. So and again, it can increase the lactate production also. So there are multiple reasons against using of soda bicarbonate, but still we might be forced to use soda bicarbonate in a specific situation where the pH is very low, like 6.9, below 6.9, or maybe a little bit early in a patient with an underlying pulmonary artery hypertension, ischemic heart disease. Maybe 7.15 we can give for these group of patients, because their chance of having arrhythmia is more, and also whenever you're having refractory hyperkalemia. So don't jump and give your soda bicarbonate, and understand what are the real indications for soda bicarbonate and what are the problems with soda bicarbonate also. So that's it from me. Thank you.